After I found out it was stage 2, and after I started sorting through details, because my initial reaction was, besides being hysterical, was to sort of systematically go through and research everything I could get my hands on so that I could ask the questions. The biggest thing that stayed in my head was that I had to direct these people because it was me. It was my life. So I talked to a bunch of oncologists. I talked to friends. I talked to people that had cancer before. And I started gathering all this information. A good family friend who was an oncologist suggested that I get multiple opinions. So I went to several different oncologists. I wanted to find the person that I could relate to. And I had gone to big offices where it was terribly frightening because you walked in the door and there were all these people with no hair and scarves and very, very sick. And then there were small offices where there was nobody around, and medium-sized, and all kind of cancer offices, and I finally found somebody who I could relate to. And then together we sort of compromised the situation and said, what do we do? Because we can do the lumpectomy and radiation and pills, or they didn't want to go further, but I challenged them to do chemotherapy as well. So they ended up doing the sandwich, the chemotherapy and the radiation and the lumpectomy and no tamoxifen. And that's what I did. I tried to be open to a lot of things. I tried to be open to, I think they called it adjunct therapy, acupuncture, relaxation, diet. I tried to affect my diet. I tried to eat healthier. I tried to stay away from things that weren't good for me. But I didn't want to put undue pressure on myself at the same time to restrict anything else. I was going through this one step at a time, and that was the only way I was going to do it. It was about 8 months. It felt like forever. I'm one of these people that if somebody presents a challenge to me, I would rather turn and go watch me to go through it because I'm stubborn. And the strength was the thing that was going to get me through this. And it did.